Okay, so we will be going over our redesign of the United States healthcare system. We want to adopt a single payer system, which provides Medicare for all, and it models a federal system that will cover all residents from our current Medicare system, and will modify and centralize Medicare to expand coverage for more people. We're taking a federal level healthcare approach to ensure the system and implementation is unified and organized and easy and efficient and easy to understand. We'll be utilizing public and private providers just to expand coverage, and coverage will include medications, surgeries, preventive care, checkups, etc. For cost, we will be able to, in order to cover to have this, we'll need to increase taxes in order to pay for all this, and costs. This will allow costs to be more manageable to decrease what the United States currently spends. So while increasing taxes may be a con to this plan, and at the end of the day, it will be more positive in the long run. So the new system will allow the United States to decrease administrative costs and will give the government negotiating power to control costs of health care.
Next, we're going to talk about the future of private insurance in this plan. There will obviously be resistance from private insurance because they're very profitable with our current insurance, with our current health system. This resistance can be incentivized. So the resistance from the private insurance can be combated by ensuring that they have a good transition plan for their livelihood moving on from the old system. The new system won't really have a lot of room for them, but as long as they can get their livelihood somewhere else, they should be happy, and will ensure that there is a transition policy to help them with this. Private insurance also spends 11.3% on administrative costs versus 1.4% for Medicare. So by transitioning to a Medicare for all system, we can save a lot of money on administrative costs as well.
The next slide we're going to talk about is wait times. So increasing coverage will also increase wait times, allowing for patients to have to wait longer before they can see a doctor. Implementing policies for individuals with severe threat of worse health outcomes, mortality, or severe pain and discomfort. The triage system is a great example of that. Encourage individuals to attend medical school to increase providers. We would also talked about implementing policies to give nurse practitioners and physician assistants more autonomy and increase providers, giving them a greater opportunity to be used in hospitals, and that way we can have more accessibility to people providing health care. And then use the Netherlands, France, Switzerland, Germany, and Australia's system to model policy to manage these wait times. We've noticed that within these places, they've had a great system in place that really helps them to be efficient. And this would help us to work with private sectors, also would implement small financial obligations for these patients. The next slide we're going to talk about is quality and sustainability. One of the questions we have is, will doctors be less motivated to provide quality care due to salary decrease? This could be an issue with doctors feeling like they paid a lot toward their tuition to get into these high quality schools to earn their degree. And so feeling like if they're not making enough money could be kind of a turnaway and a discouragement to them. And so some of the things that we've put in place to ensure that this doesn't happen is making sure that the cost is still there. And to know that the cost for these patients will increase, but this will also allow for more care that is consistent and of high quality. We believe that if our doctors are putting forth the effort to make sure that the quality of the care for the patients is something that's valuable and of great care, then that the patients should be willing to make the payments necessary for that. And obviously the emergency room visits will be something that will still have to be present. No one expects to have to go to the emergency room. That's why it's called an emergency. But making sure that this allows for the individuals to not be hit with these heavy payments, and that their insurance companies will be trying to pull out of them, but ensuring that they can still have the necessary care that they need in these emergencies. And then the last is some financial obligation on the patients. And so this having obligations for the patients to ensure that the patients make efforts to properly pursue the health that they need in these areas.
Another one of the concerns we have to talk about is incentives related to healthcare. So one of the things that draws people into the idea of healthcare, especially being very specialized or working in surgical sections, is the financial gains of working in that type of thing. So having those 3-figure salaries and really benefiting and kind of being on a next level. And so with the single payer system, doctor salaries would be decreased, which could be an incentive for people to go into different fields and instead of the medical field. So we should have programs that provide incentive, as we talked about, for them to retain that field, for them to continue to want to be interested in the medical field. So, one of the concerns that goes hand in hand with this is the idea that medical school is incredibly expensive, and it's a long-term issue. So you've got to go do medical school, you have to do residency, you have to do shadowing with different organizations. So one of the things that we've considered would be scholarships. So different financial ways to cover those costs so they wouldn't be coming out of school with such massive debt that they would have the need to have salaries that were high enough to cover those payments. And doctors who are working in these types of programs can also feel more emotionally satisfied because they can feel that they're giving better care to their patients. And other single payer systems such as that in the UK have found these results. Another thing that we'd have to look at would be for individuals working in private insurance companies. Since if we're going to a single payer system and eliminating private insurance, we have to ensure those individuals are still able to have a livelihood. So there would be the potential of offering them programs that would help them transition into a different type of field. So offering them financial or educational incentives to go into like a trade school, something so they can learn a different avenue of making their income.
Okay, so with every possible change comes the potential drawbacks and obviously resistance from the public. So there's 70% of Americans actually support a single-payer healthcare system. And interestingly, 84% of Democrats and 52% of Republicans are in support of this single-payer healthcare system. Along with some possible resistance, there is an actual potential of overuse of healthcare due to no financial consequences. So the concern of universal healthcare is that people are going to overuse this privilege. The sense of overuse actually increases expenses and wait times in doctors' offices. The costs of the sickest 5% of the population actually consumes 50% of all healthcare costs, and 50% of the healthiest consume only 3% of healthcare costs. So overall, expenses are increasing and wait times are increasing, so overusing healthcare is actually a disadvantage. There have been countries that combat this potential overuse of healthcare by enacting some financial obligation on patients. So having that actual responsibility of payment will decrease people going to doctors for small illnesses.
So in wrapping up what we've talked about in this discussion, one of the first things it does is it decreases misuse of emergency rooms through the single payer system. It increases overall health outcomes of the nation, and it decreases administrative costs. All of these are really sourced in the increase of preventative care. So by having less expensive health care, people are more willing to do consistent care, build a relationship with a PCP and do ongoing care. So if they have an issue, they're going to see it in an earlier stage and work on it with a trusted provider instead of letting it get to the point where they need to use the emergency room, which is far more expensive for the individual, for the insurer, and for the individual hospital or doctor who are giving the service. Of 33 developed countries, 32 have universal health care, and so it's something that the United States should really start looking at.